22nd hand hygiene. Hello, my name is Jonathan and I'll be your nurse for today. Can I get your name and date of birth? Hillary Clinton, 1947. Okay. You're allergic to anything? No. Are you in any sort of pain? No? Okay. Well, I'm going to check your wristband just to make sure I got the right patient. Okay, perfect. Everything checks out. I'm here today because I'm going to be inserting your urinary catheter for your urinary retention ordered by your doctor. Have you had this procedure done before? No? Okay, so basically what I'm going to do is I'm going to insert a catheter of your urethra into your bladder. I'm just going to collect the urine that is trapped in there. I'm going to inflate a balloon to keep it in place, and I'm going to attach a log to your anterior thigh so you're able to walk around freely without it getting in the way. And then I'll be collecting a urine sample. Sound okay? Okay, any questions or concerns before we get started? No? Okay. It shouldn't be painful, but it is going to be uncomfortable. But don't worry, I'll guide you through the whole procedure. Going to close the curtain just to give us some privacy. Okay, perfect. Now I'm going to collect my supplies. Perfect. I'm going to roll this up. I also noticed the chuck is warm and not damp, so I'm just going to leave it as is, and I'm going to rotate your thighs in outward direction, exteriorly. The whiteys are going to be cold, so I'm going to provide a blanket. We're gonna need this. Okay, the swabs are going to be cold, but this is why I provided the blanket. Okay. Okay, so now I'm going to be inserting the catheter. I want you to take a deep breath, and the count of 3, I'm going to ask you to exhale. Sound good? Perfect. Perfect. All right, ready? And inhale, and then 1, 2, 3, exhale. Good job. I see some urine coming out. I'm going to insert 1 to 2 more inches. Perfect. I'm going to pull to see if there's resistance. There is. Okay, perfect. Now I'm going to cover you back up again. That wasn't so bad, was it? Okay, now I'm going to gather a urine sample. I'm gonna pull out 5 millimeters. Perfect. Now I'm going to take out the gloves. I'm going to clean the site, swap the site for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Perfect. Look. Perfect. And now I'm going to attach it to your anterior thigh. Perfect. Now I'm going to throw away the box. I am going to reposition you back. Going to completely cover you now. Perfect. Wasn't too bad, was it? Next, what I'm going to do is I'm going to put the urine sample in its cup, and I'm going to document the time, date, MRN. I'm also going to look at the urine, make sure there's no sediment, make sure the urine is the proper color, which is clear and yellow. Were you able to tolerate the pain? Was there pain, I mean? No pain? Okay, would you say it was tolerable? Yeah? Okay, I will make sure I would charge it down. Okay, perfect. Like I said, I'm going to correctly label it with the correct MRM date and time, and I'm also going to make sure that I put your bed in the lowest position. I'm gonna throw this away. I'm gonna put the call out right next to you. Let me know if you have anything that you need, and I'll come to assist you. I'm also going to document the size of the catheter, which was a 16 French. I'm also going to observe the urine, make sure it was yellow, and measure the output, which was 500 millimeters. Okay, any questions or concerns? 20-second on hygiene. Hello again. My name is Jonathan, and I'll be your nurse again for today. Can I get your name and date of birth? Hillary Clinton, 1947. Okay, are you allergic to anything? No? Are you in any sort of pain right now? No? Okay, well, I'm going to double check your wristband. Okay, everything matches. So I'm here today because I'm going to remove your urinary catheter. This was ordered by your doctor. Have you had this procedure done before? No? Okay, well, I'm going to remove the stat lock from your thigh, and then I'm going to deflate the balloon. And after that, I'm going to collect the urine and put it in a container and document my findings, which is the amount, color, any foul smell, anything like that. Any questions or concerns before we get started? Okay, I'm going to close the curtains for some privacy. uncover you, and then I'm going to put you in a position that best fits this procedure. Okay, I notice you have a clean and dry chuck underneath, but I'm still going to put a towel just in case urine leaks out. Okay, I'm going to remove the stat lock. Okay, now I'm going to uncover you, and I'm going to deflate the balloon. Okay, disposing the urine in the trash. We want to make sure it's deflated. Okay. Now I'm going to ask you to take a deep breath, and then on the count of 3, I'm going to pull out. I'm going to check if there's any resistance. No resistance. Okay. On the count of 3, 1, 2, and 3. Perfect. You didn't feel any pain, did you? No? Okay, perfect. So now what I'm going to do is I'm going to collect this thing, and then I'm going to put it aside because I'm going to put it in a container. And if I noticed there wasn't resistance, but if there was resistance, I would make sure to stop immediately, and then I would call the provider. So now, like I said, I'm going to put the urine in a container. I'm going to document my findings. I am going to check the amount and the color and appearance, which is okay to me. I also noticed there was no sediment and no foul smell, and this is, you know, a good thing. And then lastly, I want to educate you on what's going to go on. I hope the next steps from now. So when you urinate, you are going to feel a bit of burning and stinging sensation, but this is completely normal, and each time you void these, this will lessen with each time. But if you notice that if there's any blood in your urine, please let me know and I can call your provider. Any questions and concerns? Okay, perfect. Now I'm going to put the call light within reach, and then I'm going to put the bed right before, like right low, and then please let me know the next 2 times you need to urinate so I can measure the amount of it and make sure that you are urinating properly. I'm gonna put the rails up. Do you have any questions or concerns? No? Okay, so now what I'm going to do is I'm going to date and time when I chart this, the removal of the catheter. Did you feel any pain at all? No? Okay, would you say that you tolerated? Okay, well, I'm going to document that as well. I'm also going to document the urine output, which was 700 millimeters. The urine was clear and yellow with no foul smell. Anything I can do for you before I leave? No? Okay.